I was watching some TED Talks to get inspiration for this presentation, and it came to me while watching 404, the story of a page not found. In the video, the speaker talks about how companies transformed their broken link web pages into acknowledgments of violated expectations, moments of humor, and ultimately, opportunities for repair and restoration. He said something during this presentation that summed up the theme of today's story. Little moments, done right, matter. I work with volunteer therapy dog handler teams in healthcare for a living. No, I'm not the exciting frontline dog handler facilitating near miraculous recovery in sick or injured patients like we see in the news. I'm more like the characters in the TV show The Office, giving PowerPoints and filing forms for hospital regulatory compliance. When I heard that phrase, little moments, done right, matter, I realized that that was the best part of my job, to help volunteers do little moments right, and to help everyone see why what they do matters. Back in April, I was doing what every good bureaucrat does and answering emails when I came across one from the nurse manager of a chemotherapy unit. The email asked for a caring canines team to visit a patient undergoing chemotherapy for nasopharyngeal cancer, who also has autism and is struggling with anxiety with the IV. His name was Noah. If it went well, they wanted animal-assisted support for the remainder of his appointments. This sounded like a typical request in hospitals, to send a volunteer therapy dog handler team to a unit to help patients reduce anxiety and promote calm. So I called one of our veteran teams, Charlie and Lily, and they rearranged their work schedule to provide support. I had no idea that this visit was not going to be a typical visit. For those of you from non-medical fields, chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. It is most often used to treat cancer, since cancer cells grow and multiply much more quickly than most cells in the body. Side effects of chemotherapy drugs can be significant, and each drug can have different side effects, such as nausea, vomiting, diarrhea, hair loss, loss of appetite, fatigue, fever, mouth sores, pain, constipation, bruising, and bleeding. Chemo is usually delivered intravenously, meaning using a needle to deliver treatment directly to the body via a chemo port, a small implantable device that goes under the skin. While ports can help reduce needle sticks and veins, they still require a needle to puncture the skin straight through to the port. For most patients, ports improve comfort, reduce pain, reduce risk of tissue damage, and allow them to perform activities of daily living, like showering, without an increased risk of infection. However, the Centers for Disease Control and Prevention says that fear of needles can be so difficult to manage that some people decline life-saving care that they need, especially if they struggle with managing strong sensations. These fears can even make the experience of getting treatments even more painful than for people with less fear. Noah's treatment was delivered via a chemo port. For someone with autism who struggles daily with sensory overload in an overstimulating world, the sensations of seeing and feeling the needle stick, combined with a learned anticipation of pain from prior experience, can overwhelm the senses and cause a meltdown. I learned later that Noah struggled with fear and anxiety so distressing that he would vomit or kick his legs while his nurses were trying to prepare him for treatment. It would normally take 3 or 4 nurses to tie restraints onto Noah, like the ones pictured here, so that they could administer treatment. Noah's nurse, Kristen, and her supervisor, Sherry, knew that there had to be a better way. If you watch medical dramas like Grey's Anatomy, you probably get the impression that the doctors and the nurses do everything in a hospital. But that's not reality. Noah's care team was coordinated by a multidisciplinary group, including his parents, nurses, nurse practitioners, physicians, physician assistants, operations managers, and social workers. There were like 20 people on the communication chain. So the care team got together, and the social worker identified during intake that Noah has a Labrador Retriever at home. They discussed with Noah's family about incorporating their pet dog into the treatment plan. Noah's mom, Sarah, expressed concern about bringing her son and their dog in for appointments, and inquired about the hospital therapy dog program instead. It just so happened that around that time, Lily had made a visit to the chemotherapy department, and she was the striking image of their canine family member at home. In that moment, Lily and volunteer services became part of that patient's care team too. Lily is a 6.5-year-old English Labrador Retriever. She has been a member of Mayo Clinic's Caring Canines and registered with Pet Partners for 5.5 years. Lily, pictured here, and her human, Charlie, visit anywhere on Mayo Clinic Rochester's campus where therapy dog teams are allowed. There's one factor that I believe drastically influenced the outcome of this request: setting boundaries. Right up there in importance to me and every other animal assisted services professional and volunteer is advocating for your dog. On the destined day of the first visit with Lily and every follow-up appointment thereafter, Charlie did both. While preparing for the procedure, Noah's nurses shared with Charlie that Noah's fear can become so overwhelming that he kicks his legs. They discussed and implemented a plan to keep Lily safe and reduce risk by having extra staff support available, positioning Lily far enough away that she would not be accidentally struck, and Charlie could take her right out the door quickly whenever they needed. After the safety plan was decided, Charlie brought Lily into the waiting room to meet and visit with Noah prior to his appointment. They walked him back to his room and gave him time to pet Lily while the nurses prepared his treatment. "Lily wants to be here for you," Charlie said, "but we need to make sure that you're both safe. Can you promise not to kick your legs? If you need to kick them, we'll need to leave." What makes this story so special to me is what happened next. For the first visit with Lily, there were 2 nurses in the room during the port access. The procedure went smoothly, and both nurses said it was the easiest it had ever gone. The final week of treatment, only 1 nurse was in the room, and another was available nearby if needed. Noah's parents had left the room, and it was only Nurse Kristen, Charlie, Lily, and Noah. Kristen asked Noah, "Can we do this with just the 4 of us? Or should I go get some help?" Noah thought about it for a moment and then replied, "Yes, just the 4 of us is enough. I can do this." She was able to successfully access Noah's port, and Noah was able to act with agency and complete his treatment on his terms. Lily's presence cultivated a sense of normalcy, familiarity, and safety that eased Noah's anxiety and allowed him to relax during treatment. A couple weeks later, I received an email from Charlie with an update about how the visits had been going. I called members of the care team to verify details of his accounting and hear the perspectives of their experience. It was then that I realized this was not a typical sit in a room and let the patient pet the dog for a few minutes and leave kind of visit that most of the public may broadly perceive volunteer visiting animal programs as. Since the involvement of Lily in Noah's care plan, the number of nurses required to complete the procedure went from 4 to 2 to 1. The nurses were able to reduce and eventually eliminate the need for restraints. More importantly than those nice, tangible outcomes we love in healthcare was the change in the overall narrative of the staff, the patient, and the family. Noah's narrative changed from "I had to endure while treatment was forced on me" to "my care team put my needs first and helped me feel safe so I could participate in and complete my plan of care." In other words, "Hey, good news! I saw a dog today." Noah successfully completed radiation and chemotherapy treatment and rang the bell by the end of May. Exposure to hospitals and everything that goes with the experience: illness or injury, symptoms, side effects, diagnoses, day-to-day life disruption, and the weight of the unknown in an unfamiliar institutional setting can create or exacerbate medical-related anxiety and complex trauma. Traumatic experiences for patients are often just as traumatic for the staff who try to treat them, bearing the weight of the need to sometimes inflict temporary discomfort or pain in order to provide longer-lasting and hopefully more permanent healing. This case demonstrated tangible outcomes that could be part of the opening of a new door to enhancing patient experience. Some examples of these outcomes include reduction in workplace violence, reduction in the use of restraints, improved patient consent, agency, and motivation in the plan of care, improved staff morale, and improved staff safety in carrying out patient care. While I think these outcomes are valuable, I think Noah's mom, Sarah, articulates the value of animal-assisted support better than any of us or any of these outcomes ever could. Here was her email to me after Noah's visits with Lily. My name is Sarah. My 21-year-old son, Noah, was diagnosed with nasopharyngeal carcinoma in December of 2022. It was a hard blow after my metastatic breast cancer diagnosis in November of 2021. We knew it was going to be a tougher journey as Noah is on the autistic spectrum. For the first part of his treatment, we did chemo back at home at our cancer center. He handled it well the first 2 chemo treatments. After, he began having episodes of vomiting due to anxiety. He was prescribed Ativan and it seemed to work for a while. We made our journey to Mayo Clinic Rochester to resume treatment on April 10th. Noah handled radiation like a champ. At first, he didn't seem bothered by being bolted to a table by a mask for 45 minutes every day, 5 days a week for 6 weeks. Issues with chemo became more intense. It got to the point at his 3rd chemo in Mayo that he had a pretty bad panic attack. There was no reasoning with him. He was flailing, sweating, with rounds of vomiting and tears streaming down his face. He knew what was going to happen and he needed to have chemo, but his mind just wouldn't let it happen. Myself and 2 other nurses had to hold him down to get his port accessed, and chemo started. It was very stressful and hard for me as a mother to deal with. As Noah sobbed, he apologized for his behavior, and all he wanted was his own Labrador, Emma. We have 4 dogs of our own, and we have our special girl, Emma. My father-in-law bred his yellow lab, so we witnessed Emma being born, and Noah helped raise her and her siblings. Emma is very special to him. It was a wonderful surprise when we saw Lily in Noah's treatment room. She's the spitting image of our dog, Emma's mother. It was a very comforting sight for Noah and even myself. He's been missing Emma so much, and to have Lily there was nothing short of a blessing. Right away, Noah calmed down. Even on Ativan, he was still having a hard time, but Lily's presence was just magic. Noah talked and talked about his dogs at home with Charlie while petting Lily. He was so much calmer. He let the nurse do what she needed to do without any issues. Yes, he still had bouts of vomiting, but nothing close to what it had been. The visits with Lily have helped Noah tremendously. I can't begin to express how much he needed this kind of therapy. This is something that should be offered to anyone who's having a hard time with any sort of medical circumstances, especially chemo. It's so mentally hard to grasp that you have cancer, but then that your body is getting pumped full of drugs that will cause hard side effects. Charlie was wonderful, listening to everything Noah had to say and sharing pics with Noah. Getting a chance to love on a dog, especially another Labrador, got Noah through his chemo treatment. I just want to share our story and how big of an impact even an hour visit with Lily made. Thank you for offering these services, and thank you to Lily and people like Charlie who offer up their time and their dogs to people who really need them. So being in volunteer services and patient experience, we knew that this was an opportunity for a little moment done right to matter. We got the care team together for celebratory photos to commemorate their accomplishments, shared the story widely within Mayo Clinic's network to educate clinicians on how to provide similar service for their patients, and provided Noah with a stuffed animal of Lily as a keepsake. That keepsake will forever be a bridge between his world and the hospital. In hospitals, we often jokingly say, we hope to never see our patients again, implying that they live long, healthy, happy lives. While we hope to never see Noah again, if we do, we hope that this small token will help him feel that his safety and his needs matter. Thank you.